Hello, guys, and welcome to the Joy Report, where we get an outsider's view with an insider's clarity. Let's get into it.
Here is the truth. There are Medicaid cuts in Trump's big, beautiful bill. Number one, adults without kids. If you're low income and you don't have children, you could lose your coverage. The bill rolls back the Medicaid expansion that helped millions of working adults get insured. Number two, parents with teenagers. If your youngest child is over the age of 14, you will be required to work or volunteer 20 hours a week to keep Medicaid. Miss that requirement even by a little and you could lose coverage. Number three, people in certain states. Some states never expanded Medicaid. This bill locks those limits in, meaning millions of adults in places like Texas or Florida will have no affordable coverage options at all. Number four, disabled or chronically ill people. Even people with real health problems could lose coverage if they don't have the right paperwork or keep up with the constant re-verification. Red tape could cut them off, and that's because of all the fraud, waste, and abuse. Now, number five are young adults aging out. Teens who turn 18 or 19 may no longer qualify under the new rules. If they're part-time workers or students, they may not meet the new work requirements and could possibly lose access. And number six, rural Americans, they rely heavily on Medicaid to keep local hospitals open. These funding cuts could shut down some of those hospitals, leaving people with no nearby places to get health care. So even though there are benefits to the working American in the big, beautiful bill, there are those Medicaid cuts that can potentially put some type of hardship on Americans as well.
So they officially passed the big, beautiful bill, and it's now going to go into effect. But it's just really dumb to me because they're going to be cutting Medicaid and SNAP benefits. So what is the point of that? They're also cutting student aid and then cutting funding from public schools as well. But you know what they're going to do? They're going to take away the tax on gun silencers. They're going to lower the taxes on that, because that's what matters. You know what I mean? It's just crazy that they called it a big, beautiful bill, when it quite literally is going to affect a lot of Americans in a negative way because they receive these benefits. They receive this government assistance because they need it, and that's why they have it. And now all of that shit is being cut. Makes absolutely no sense at all. And it's being cut in order for rich people to get more rich, when the people who are on assistance because they need that. The rich people don't technically need that government assistance.
Yeah, Trump's bill that's about to pass the House is going to cut Medicaid, but I'm not on Medicaid, so why should I care? I would love to get on here and explain to you all the reasons why you should care about other people, low-income people losing their health insurance by Trump's Medicaid cuts. But you don't care. You don't care. I want you to care, but you don't care. What you care about is how Medicaid cuts would hurt you. So that's what I'm going to do. I'm going to explain to you how Medicaid being cut is going to be bad for you, a person who's not even on it. Okay? All right. Stay with me. I'm going to go real slow. When uninsured people go to the hospital and they can't pay, but they go to the emergency room anyway because they're about to die for some reason, and they can't pay, hospitals and providers eat those costs. It's called uncompensated care. Those losses that the hospitals just ate and the providers ate are oftentimes passed on to privately insured patients by way of higher prices and higher insurance premiums. That's you! You see how we got to you? Do you see how you're in it now? So by covering low-income individuals through Medicaid, the same Medicaid that Trump is trying to cut, it lessens those uncompensated costs, which keeps your premiums down. You see that? This is about you. We don't even have to have a bleeding heart. We don't have to care about everybody else out there. We can just care about ourselves and still fight against these Medicaid cuts. And this is not just my opinion. The Kaiser Family Foundation did an entire study that showed that Medicaid expanding Medicaid in states, lowers hospitals' uncompensated care by 25 to 40%, depending on the state, which eases the financial pressure on the entire healthcare system. That's you. You're in that too. Medicaid is also just preventative. It being in your state prevents things that happen that would exhaust your healthcare system that you would have to pay for. Lutheran Services of America is a very good example of that. The people who get Medicaid through them get all this preventative care, and they get care coordination and in-home support, and it improves the health of the people who are on it, and it reduces their need for high-cost healthcare services, right? And so then those members remain healthy, and they end up participating members of the economies around them. Like, it's just a good thing to have in your state economically. So look, the big, beautiful bill that wants to cut this, Trump's bill that wants to cut this, has already passed the Senate. We're in the final hours. We have like a day. You have to call your representatives. You have to tell them not to make these cuts to Medicaid, right? That people need them. That even if you're not on them, that they help your local economies as well. Find whoever your representatives are at the federal level. Find your representative, email them, call them, do whatever you can. You literally have a day. I did it earlier today to tell them, urge them to vote against something that's not just going to hurt the people around you. It would hurt you, whether you're on Medicaid or not. Okay? All right.
Today, we're going to talk about Black Americans' reactions to DT's Big Beautiful Bill. DT's so-called Big Beautiful Bill has finally landed, and many Black Americans aren't holding back their reactions. Despite the bill being hyped up as a sweeping reform aimed at reviving the economy and cutting waste, its fine print paints a different picture, one that disproportionately affects working class and marginalized communities, especially minority groups. Across social media, frustration and disappointment are growing, and many feel like this bill is yet another slap in the face masked in political fluff. Before we proceed, all credit goes to the creators of these videos. Let's watch a few more reactions and I'll come back with my final commentary.
Never used mental health care and never plan on using mental health care and don't know anyone who's ever used or benefited from substance use treatment, never lived in a rural area, never needed a hospital one, have never visited an emergency room and don't plan on ever needing one. And if you don't know any children, elders, or disabled individuals, then by all means, keep on scrolling. But if any of that sounds even remotely familiar, then we need to talk about this bill because it affects all of us. What I'm seeing right now is a crisis. This is not a policy debate. This is a public health emergency. Over 16 million people could lose care, and no community, urban, rural, anyone is safe from the fallout. When it comes to this bill, it's more than numbers. It's the dismantling of care. 72 million Americans rely on Medicaid. It covers 40% of all births, most nursing home stays, and nearly all of addiction treatment. And now it is being gutted. According to the Congressional Budget Office, nearly 12 million people will lose coverage, most of them losing Medicaid. And I want to talk about the ripple effects because this touches everyone and you may not understand it. Let's go down to categories. Mental health care. Medicaid is the #1 payer of mental health services. When the funding drops, wait lists will grow, providers will vanish. Substance use treatment. 40% of all substance use care is Medicaid funded. These cuts mean fewer detox beds, closed rehab centers, and more overdose. Rural hospitals, they're already struggling, and 300 plus rural hospitals could shut down entirely. This means pregnant women driving 40 plus miles to give birth and patients dying before ambulances even reach them. Emergency rooms without coverage, people will wait until crisis hits. That overcrowds ERs, increases costs, and delays life-saving care. Children, elders, and disabled individuals. According to congressional testimony, this bill endangers children who are already food insecure, disabled individuals who rely on in-home care, and seniors in nursing homes. Over 37 million children get health coverage from Medicaid or CHIP. The cuts will force many of them off insurance altogether. The bill also slashes SNAP, which is food assistance for 5 million families. ACA subsidies are being slashed, so millions of working class people will see their premiums spike by 75%. This is more than cuts. It is a coordinated rollback. So let's be coordinated in our action. What can you do? Call Congress. Use credible resources like Mental Health America, who has a call script, and find out how to protect care in your state, and share this video. But let's be clear. If you hate children or elders or people with disability or folks living in rural communities or historically excluded groups or anyone who gives birth, then by all means do nothing. But if you don't hate them, you need to call your representative.
At the core of the backlash is a harsh reality. The bill includes major cuts to essential programs like Medicaid, Medicare, and SNAP benefits, the very lifelines that millions of Americans depend on just to survive. These aren't luxuries. These programs provide food, medicine, and basic health care for families who often work full-time jobs yet remain in poverty. In many Black communities, where systemic inequality and limited access to healthcare have always been pressing issues, these cuts feel targeted and cruel. One of the most alarming aspects is the proposed slashing of Medicaid. This isn't just about trimming a bloated budget. It's about stripping healthcare from low-income families, elderly individuals, and disabled people. In predominantly Black communities, where access to private insurance is still a challenge, Medicaid has been a critical safety net. Removing or reducing this support means more people will go without doctor visits, medications, and life-saving treatment. The burden will fall hardest on those already living paycheck to paycheck. Medicare cuts are another blow. Seniors who worked their whole lives are now being told to tighten their belts even more. These are grandparents who rely on consistent healthcare coverage who can't afford sudden hikes in prescription costs or doctor fees. The bill's quiet reduction in funding for Medicare Advantage programs will likely result in fewer services and more out-of-pocket costs for older Americans, many of whom are seniors living on fixed incomes. SNAP, better known as food stamps, is also on the chopping block. While some lawmakers frame it as reducing dependency, what it really does is increase hunger. Food insecurity is already a persistent issue in many black neighborhoods, often referred to as food deserts due to the lack of affordable grocery options. Cutting SNAP doesn't encourage self-sufficiency. It just ensures that more families will go to bed hungry. It's not reform, it's punishment. Some supporters argue that this bill is necessary to cut national debt and encourage people to find work. But this talking point overlooks the complexity of poverty and job scarcity, especially in underserved areas. You can't pull yourself up by your bootstraps if you don't even have the boots. And with rising costs of living, stagnant wages, and job markets that discriminate based on race, many black Americans are simply exhausted by empty promises. Black Americans aren't buying this big, beautiful bill. They're calling out the hypocrisy of a bill that claims to help while quietly hurting. And they're not alone. As opposition bills, one thing is clear. This bill may be beautiful to billionaires, but to working-class Americans, it's just another reminder of a system that refuses to see them. So what do you all think? How would cuts to Medicare, Medicaid, and SNAP affect your community? And do you think this bill was designed to help working people? Let me know your thoughts down in the comment section. I would love to keep this discussion going. Otherwise, that's it from me. I also have another video about Miami Cubans calling out their own, and if you enjoy such kind of content, please click up here and enjoy. Also, consider subscribing, liking and sharing, because it helps me grow my channel, and YouTube recommend my video to a wider audience. But for now, thank you so much for watching, and until the next time, the Joy Report out.